There was no evidence to support the use of a fourth dose of COVID-19 vaccines developed by Pfizer and Moderna in the general population. This was according to the latest update from European health agencies. However, they recommend a second booster for people aged 80 and above. In a joint statement of the European Medicines Agency and the European Center for Disease Prevention and Control, they said that there is no clear evidence that in the European Union that vaccine protection against severe disease is waning substantially in adults with normal immune systems aged 60 to 79, and thus no clear evidence to support the immediate use of a fourth dose.
ECDC and the European Medicines Agency EMA have issued advice on the use of a fourth dose or a second booster of mRNA COVID-19 vaccines in the European Union. Overall, it is too early to consider using a fourth dose in the general population, with some exceptions. A fourth dose should be given to adults 80 years of age and above because of the higher risk of severe COVID-19 in this age group, as well as the protection that a fourth dose provides. A fourth dose is already recommended for people with weakened immune systems. This should continue as it is. There is no clear evidence at the moment that vaccine protection against severe disease is waning substantially in adults between 60 and 79 years of age with a normal immune system to support the need of a fourth dose. Nevertheless, national authorities should closely monitor the population experiencing severe COVID-19 and decide to use a fourth dose if there are signals of increasing risk among those who already received the third dose. We at ECDC will continue monitoring the situation, and if the current epidemiology changes or if new evidence emerges, including increased risk of severe illness among those who are vaccinated, the recommendation for this age group may change. Finally, for people below 60 years of age with a normal immune system, there is no indication that an additional booster dose is of value at the current stage. Recent data show that most of those suffering from severe illness continue to be persons that are unvaccinated. We urge everyone to complete their vaccination schedules for both initial and booster vaccination, if not done yet. As of the end of March, 83% of adults 18 years old and above had received full initial vaccination, and only 64% had received a booster. We can and should do better. Vaccination against COVID-19 remains the most effective way to curb the pandemic and to protect ourselves and our loved ones. Vaccines work. They are safe and they can save lives.
Authorities will continue to monitor data to determine if there's an increasing risk of severe illness among those who are vaccinated. According to them, if the current epidemiological situation changes and new signals emerge, it may become necessary to consider a fourth dose in this age group. But for now, national authorities will also consider local data in deciding whether to use a fourth dose in those people at higher risk. For adults below 60 years of age with normal immune systems, there is currently no conclusive evidence that vaccine protection against severe disease is waning or that there is an added value of a fourth dose. I am Lovely Montoya of Manila STV.